Welcome to the Swansea Bay University Health Board Cardiac Rehabilitation Team Talk about activity and exercise. Disclaimer. Exercise is not without its risks, and this or any other exercise program may result in injury. This is not individually prescribed advice, so before you start exercising, please consult your cardiac doctor or cardiac rehabilitation team. When exercising at home, choose a clear space at a comfortable temperature and having drinking water available. Please wear loose, comfortable clothing and flat, non-slip supportive footwear. Only exercise if you are feeling well. During exercise, it is normal to feel slightly warm, slightly out of puff, experience light perspiration, feel your muscles working and feel your heart rate increasing. It is not normal to experience dizziness, palpitations, undue breathlessness or chest pain. In these instances, you should stop, rest and allow the symptoms to ease. Should they not ease, follow any guidance that you have been given and seek medical advice. If you experience pain in your joints or muscles, stop, check your positions and try again. If the pain persists, seek medical advice. However, feeling that your muscles are working and slight soreness the next day after exercise is normal and shows the muscles are working. Breathe normally throughout and try not to hold your breath. Patients who have undergone cardiac surgery, for example bypass or valve surgery, and have had their chest bone opened need to be careful with arm and chest exercises for 12 weeks to allow the bone to heal. Exercise within a comfortable range and avoid heavy lifting. Only do what is comfortable for you and seek advice if you have any issues or concerns. Remember, moderate intensity exercise with a warm-up and cool down is a safe and effective treatment for your heart. Some people can be worried about activity after heart attack or surgery, but the good news is that regular moderate exercise can help your recovery, and it can also reduce the risk of more heart problems significantly by up to 30%. So much so that a number of combined studies suggest that the power of regular exercise is as good as the combined benefits of all prescribed heart medication. Regular exercise has enormous benefits to all parts of our bodies. For instance, exercising lowers risk of cancers drastically, depression by nearly 50%, and lessens the risk of cognitive decline significantly. Also, the risk for high blood pressure and type 2 diabetes, both risk factors for heart disease, are really reduced. Even after heart attack or surgery, exercise can benefit your heart and body circulation, which will mean you will be able to do things for longer or do new things without getting too tired or too out of breath. Your heart is a muscle, and gradually increasing what you do will also strengthen it as you recover. Some people do have a genetic family history of heart disease, and this can make them feel that exercise won't help and think, why bother exercising if I have bad genes? But the good news is that you can improve your health despite so-called bad genes. Exercise may also help to control weight, but its effect is generally very small. So if you are looking to lose weight, we recommend you focus also on getting dietary advice. But remember, as we showed in the last slide, fitness improves long-term health massively in many ways, regardless of weight loss. Activity also helps other things related to heart health, such as cholesterol. Improving cholesterol levels helps long-term artery and heart health, and regular exercise generally helps to change these positively. Also, resting blood pressure can be reduced significantly too. Other improvements to health by exercise can be due to improved glucose control, especially in people with type 2 diabetes, and this can help to manage diabetes better. There's lots of evidence that exercise makes you feel good, as it tends to regulate hormones, which have been shown to drastically improve mood, especially if you go outdoors to do it. Also, making it social by exercising with a friend, partner or in a group really helps to lift mood. Active people are also less prone to painful conditions like arthritis, and there is evidence to suggest that activity can help to manage pain symptoms better. After surgery, scars can get tight, and graded activity to help stretch them can be beneficial, and take advice from your cardiac rehab team about the right stretches. People who do little activity tend to get stiff and can gradually lose their balance as they get older, but this can improve with regular activity. A good way to describe and measure your exercise is called the FIT principle. FIT stands for frequency, intensity, time and type, and we will discuss them in the next slides. However, please remember it's always important to do a warm-up before and a cool-down after your exercise. For example, if you were doing a 20 to 30 minute exercise plan, we would recommend a 10 to 15 minute warm-up before and a 10-minute cool-down after. So how much exercise is recommended? This relates to frequency, how many times a week you exercise for, and time, how long per session or per day you do the exercise for. Recommendations in the long term are for 150 minutes of exercise per week. However, while recovering from heart attack or surgery, it will take time to build up to this amount, so pace things steadily and take advice from your cardiac rehab team if needed. There is good evidence for 150 minutes to be split up into approximately one 30-minute session for 5 days a week, with a couple of rest days. However, not everyone can do this, but even short bouts of exercise are beneficial. For instance, 3 sessions of 10 minutes in a day still add up to 30 minutes by the end of the day, and these may be easier to do due to fitness or time pressures. Even just a few minutes regularly can be helpful. However, to get a good benefit, you want to aim for the 150 minutes over the week. There is also evidence that doing one 150-minute session once a week is also somewhat beneficial, but not maybe as helpful as the 5 30-minute sessions. And doing longer things may be too much for some people, especially while recovering from heart attack or surgery. If this is something you're considering, then please contact your cardiac rehab team for individual advice. So we've talked about how many times a week and how long per session to exercise for. Now we'll discuss how you should feel when exercising, which relates to the intensity and also to the type of exercise. Initially, during your recovery, it's recommended you do what's called cardiovascular or aerobic exercise. These should be bodyweight exercises and or light resistance exercises where you should feel warm, slightly sweaty, slightly breathless, but you should still be able to hold a conversation. Adjusting your pace as you do these to find the right amount for you is important. One way to help you to adjust your pace for the best benefits is by using the effort scale. The ideal zone for exercising is a 3 to 4. If, for example, while you're exercising you think the exercise is very light and you score yourself a 2, you should try to increase your effort until you are at a 3 to 4. And likewise, if you score yourself a 7, which is very hard, you should reduce your pace until you are at 3 to 4. As you get used to these exercises, you may be able to build up steadily over time. These exercises are generally helpful during recovery and can be done in the long term to help heart health. There are ways of building up steadily over time. You could increase the time you do the exercises for, the amount of time per week, or you could change and make the exercises harder. This is generally okay as long as you build up steadily. Even graded weights programs have been shown to be helpful in lots of people with heart disease, but these programs need to be individual. So if you are considering this, please consult your cardiac rehab physiotherapist or cardiac rehab exercise instructor. One of the ways that building up your exercise ability can be difficult is when people overdo it and get into a cycle of boom and bust. They may have days where they feel energetic and then do lots of jobs or activities which can then directly lead them to having a bad day next day with no energy or feeling painful or strange. A way to break this cycle and increase your exercise ability safely is called the 10% rule. This means even if you feel energetic and want to do lots of things, try to keep the amount of activity similar to previous levels and just add 10% on top of what you did recently. This still means you're improving and it is much more tolerable. Also, the 10% can add up quickly. If you want to do the activity again and you feel okay the next day, then add in another 10%. Some activities can be easier or harder depending on what you're doing. For example, cycling can be good when on the flat, but hard going up hills. But cycling is generally better tolerated if you have a knee problem than, say, dancing. Gardening can give you an overall workout and can be easy or hard as well. Golf is hopefully a good walk and a good score, but try to avoid the use of buggies. Swimming or aqua aerobics can give a good overall exercise, and some people with painful joints find it easier to exercise in water. Water exercises are generally well tolerated by people with heart conditions, but the heart has to work a little harder when it's in water, so the advice is to make your pace a little easier in water compared to on land. And patients who have had surgery where their chest bones have been opened are advised to avoid swimming for 12 weeks. Why not try out walking or exercise groups like the National Exercise Referral Scheme? These can be great ways to socialise and exercise at the same time. Everybody has different goals after heart attacks or surgery. Some people want to walk upstairs without getting out of breath. Others may want to walk up mountains without getting tired. Others may want to be able to walk around town or be able to do some gardening. Whatever your goal is, it helps to make a plan about how you are going to get to do it. For instance, walking a long distance may need some training of building up shorter walks first. Making a plan of how to build up your activity towards your goal over time will help you to avoid boom and bust. Also, using a diary to record your progress may encourage you to keep going. Try to remember your pacing, your intensity, and the 10% rule. There are everyday activities that can be helpful, but try to keep the correct pace and time. Walking daily with a dog in the long term will help your health, but remember to try to keep the pace at the correct intensity. Housework is generally classified as a light activity, but again remember to try to aim for a 3 to 4 effort intensity. Some DIY can be easy and some very difficult, so you may need to plan it correctly. Parking. Why not save yourself the stress of car parks and park a bit further away in the car park where there is usually more open space, and which will also mean a walk of an extra 1 to 2 minutes. Also, you may want to consider use of stairs instead of escalators when out and about at shops, or go up and down your stairs at home more often as an exercise. It all helps. If you were going back to work, why not plan a lunchtime walk regularly, or could you cycle to work sometimes? Why not try to cycle or walk to local things like friends or shops instead of taking a car? And if there is something in your daily activity that you're struggling with, try to break it up into smaller amounts to start with and then gradually build back up over time. There is lots of information on the internet, but take medical advice before starting something new. Examples of things on the internet are Swansea Bay NHS TV channel on YouTube. Just search for Cardiac Rehab Swansea Bay NHS TV. Another example is British Heart Foundation Cardiac Rehab at Home. Whatever you do, follow the advice in this talk according to the FIT principles. There are many different devices available and many smartphone apps. These can be great motivators as some apps will help you set goals and record exercise or food intake. Some will also help you manage stress. However, try not to get over vigilant with them. For instance, we would not usually recommend looking at your pulse rate or blood pressure too often. Guidelines for safe exercise. Start slowly, especially if it's something new, and build up steadily, remembering the 10% rule. Remember, warm-ups and cool-downs are important as they let the heart adjust to changing levels of activity and help to stop any potential problems. If you haven't done the same level of exercise for a while, remember we all lose fitness if we don't exercise. Just remember to reduce what you do when you start back. If you're diabetic and you check your blood glucose, It is not recommended that you exercise when you have readings below 5.5 or above 13. Remember to drink water and have a glucose sweet or drink ready just in case your blood sugars go low. Also, if you have any changes in sensation in your feet, make sure you wear very comfortable footwear and inspect your feet to make sure you don't have blisters. Don't safe exercise. Do not push through pain, dizziness, cramp, or being unduly short of breath. Sit down until things settle. If you have chest pain that doesn't settle, then follow the GTN protocol. Don't exercise during illness, wait until you feel better. Be more careful on extremes of temperature, so if things are very cold, then wrap up well and put a scarf around your mouth. Do not do formal exercise on a very hot day, although a gentle walk might be okay for you. Do not have a big meal prior to exercise and leave at least an hour prior to exercising. Do not have a very cold shower after exercise, as your blood pressure may drop too quickly and you may feel dizzy or faint. Don't do maximal intensity. Maximal intensity exercise means when you're trying to lift or move something and you are using everything you can to do it. Instead of doing it just yourself, ask for help to do it between 2 or 3 people. This doesn't mean you can't do some heavy exercises as long as you've built up to them, as we discussed earlier. Again, take individual advice from your cardiac rehab team, as maximal resistance is different for everyone. To recap, regular graded exercise is one of the best things you can do for your heart and is safe, but please follow the guidelines set out in this talk. Hopefully this talk has given you guidance to help your recovery and long-term health.